Hi and welcome, and thank you very much for coming today. So today is the launch of our Research Council funded mental health and loneliness and social isolation in mental health network, and you're here largely as members of that network. We're delighted to see you together at NIHR School for Social Care Research, and the early afternoon session will be about that. So the way we've structured today is I'm going to say a little bit about the network and what it's all about to start with. We're then going to have a series of very kind of tightly chaired sessions. So we've got what the network is going to prioritise and how we're going to take things forward to be as effective as possible. We're trying to capture people's inputs by as many methods as we can. You'll be sent a link afterwards to an online survey for your further ideas about how we should work. If you look behind you, you'll see that we've got a tree that's been put to one side at the moment of the day. We've also got some fine young researchers with microphones who will be, I think with phone microphones, who will be wandering around trying to speak to people and ask you about your thoughts about things that haven't come out in the discussions. If you don't want to speak to them, please just decline. If you are happy to speak to them, they'll record what you've said and we will transcribe that. So just speak to them if you would like to do so. Okay, and Hannah is going to say something about the usual stuff about fire exit and toilets.
Yeah. Hi. So there are no fire doors planned, so if the alarm goes off, we go out the third door and go down the stairs. It's immediately on your right, sorry, I'm really bad with left and right. On your right hand, there's one right hand there. On your right hand side, if you just go down those stairs, we kind of go onto the street. It's quite straightforward. It says fire exit. It's guiding you towards the toilet. So our toilets on this floor, if you'd rather not walk the stairs, but they're all the way across the main hallway.
Yeah. Anybody got any ideas? Jean around, or is the AV person around?
Is anyone with a MacBook? No. Jean's just
Yeah, well, I do.
It's been investigated rather less than you might think. A lot of the work on loneliness also is some people who are lonely are more likely to develop depression. We also know that loneliness is something that's related to quite a lot of other social adversities. So if you're on a lower income, living in deprived circumstances, you're more likely to be lonely. Moving on to people who've already got isolated. So loneliness and social isolated, and likewise, lonely people less well from other mental health conditions. Mortality is greater. Can we do anything about this? Well, what we know at the moment is that there are various interventions that do successfully get people to participate more in society, that make people more connected to other people. But it seems harder to do anything about loneliness, and we know less about how in the general public or in specific risk groups in the general public, like, for instance, young people or new parents. We don't know whether targeting loneliness could also be a way to prevent mental health problems like depression. We also don't know that much about how people who've already got mental health problems experience loneliness and social isolation, and how well the existing measures, so things like the UCLA loneliness scale that's been around for several decades, we don't know how well that actually relates to what people experience. Among people with mental health problems, we don't really know whether there's anything that can effectively be done to reduce loneliness, and we don't know whether doing that makes other aspects of their experiences and their outcomes of their mental health problems better than they might otherwise be. So this is where our network comes in. So what is the network? It's funded by all the UK research councils together, so not just the ones that usually fund mental health research, but also the Arts Council, the engineering, and I can't remember the names of them, but the councils that we might normally never think about are also involved. They've commissioned 8 networks, of which this is one. Most of them have quite a social focus, in fact, so most of them are quite obvious ones to collaborate, so hopefully the 8 networks together will be more than the sum of their parts. Their aim is basically to produce a step change in mental health research in certain areas by creating networks which are cross-disciplinary, which bring together perspectives and partners that wouldn't so easily usually come together. And it's a model that's been used effectively already, is to establish a cross-disciplinary network that allows rapid advances to be made in our area of interest by doing things like creating links across areas and disciplines, mapping the evidence and giving rise to some larger projects that can be funded, experience voice on this topic. Another big aim is to try and develop early year researcher capacity in this area and to try and support the careers of existing early career researchers there and identifying priorities for further research, meaning to address loneliness and social isolation, a potential preventive intervention in mental health. What are the current impacts and experiences of loneliness and social isolation on people who are living with mental health problems? And is there something that can be done to alleviate those? And if so, which? And some scoping of what's out there, further research. Having a set of which could be done to think about what the next steps are. Hopefully a lot of online activity as well around this. Hopefully setting up some small groups to focus on particular areas and begin to develop work in those areas. We'd like your input as to the best ways of achieving our goals. We'll then, between 19 and 36 months of the life of the network, be commissioning a series of small projects, not just from network members, but from any bidders. The only service user or survivor or people with lived experience led within this series of projects. We've got £450,000 to spend, so we can't do a massive trial, but we can hopefully commit the money wisely to a series of small pieces of work that move things forward and move towards larger pieces of the network, and we'll be able to provide some support to these projects, and the PPI group will also be there to support them. Then we come on to stage 3, which is a final conference, at least one roundtable event to tell policymakers what we've been doing, at least 3 planning meetings to initiate larger scale proposals for further research. Okay, so at this point it's probably a bit time consuming, but I got so excited about the disciplines involved that I used one of those foolish PowerPoint animations. So here you are. At least that was faster. So all sorts of disciplines. There's a very wide range. We're starting to meet lots of interesting people we wouldn't usually get to work with. So that's a big benefit. This is not even a comprehensive list of disciplines who are going to contribute. But the kinds of questions that we would like you to have in mind through the day and to feed back on to us on are these. How can we make this network as productive as possible? We've got £1.25 million invested in this, which is arguably a lot of money for a network that's not actually doing a big piece of research. So we want to make it as effective as possible. We want to think about how we can measure its success, how we can make it as inclusive as possible, who else we should include. So the idea is that it's a network that grows considerably through its life. What should we prioritise? What kinds of activities and subgroups is it helpful to establish? And for particularly these Network Plus projects, these small research projects that come from it, we would like to know how we can best support those, including supporting people to develop those projects so that they look suitable for funding when we come to select projects to make an investment in. Okay, and as I said, Leaves online questionnaire, talk to the people with phones who'll record what you say, but also thank you. I set a bad example, but I did have an IT problem, a technology problem. I'll hand over to James to chair the session. James will also Nick, who is co-chairing with him, who's one of the lived experience group from Code Community Navigators.
Hi everyone, thank you for joining us today. It is great to be at a friend's house to be discussing a session on loneliness. We're going to have 5 speakers in the next session.